New at 10, breast cancer is on the rise in younger women. It's a trend puzzling medical doctors, but they have theories. CBS 2's Maribel Gonzalez explores those and what you can do to best protect yourself and your loved ones.
At age 39, there was nothing physically wrong with Marissa Lanzito.
I didn't have any symptoms. I have no family history.
Only an intuition that something wasn't right.
I know if something keeps coming back to me and keeps nudging me, I have to listen.
She took her concerns to her doctor and asked for a mammogram.
She said, you don't have any family history. You have no symptoms. We don't feel anything. You don't feel anything. I mean, it's unnecessary and your insurance isn't going to pay for it.
But she insisted.
She's like, I'll give you the order, but you have to hang on to it until you turn 40. So I did. It was only a couple of months. And they did find a tumor, and they took a biopsy, and it wound up being positive for breast cancer.
Marissa is part of a growing trend. A study published this month in the Journal of the American Medical Association shows that more people under the age of 50 are getting cancer. Breast cancer saw one of the highest increases in the number of early onset cases. From 2010 to 2019, that number increased by nearly 8%.
We don't really know the answer to why. We know that this is happening.
Julie Wexler is a breast surgical oncologist at Cook County Health.
There are, multiple theories as to why, but we don't really have solid evidence. Some people talk about lifestyle factors, environmental contribution.
Dr. Wexler sees patients after they've been diagnosed.
It's rare in your 20s. It's still uncommon in women in their 30s. Obviously, in women, as you get older, your risk increases, but that's not something that we can definitively say that you're too young to have breast cancer.
Right now, the U.S. Preventative Services Task Force recommends women begin getting mammograms at age 40, up this year from their prior recommendation of screening at age 50. But if more women are getting cancer at a younger age, why aren't they getting screened?
Because of cost, because of availability of resources, and because there's the incidence of breast cancer is not high enough to warrant doing that. We also look at lymph nodes.
What is available is a breast cancer risk assessment starting at age 25, explains Dr. Lisa Stemple, a radiologist at Rush University Medical Center.
We ask women a bunch of questions, and they go through the model, and we find out what their lifetime risk of breast cancer is.
What are some of those questions?
Family history, hormonal history when at the age of menstruation, the age of first pregnancy.
These patients who rate high are referred to more testing because the earlier women are diagnosed, the better the outcome.
If we can find breast cancer in stage 0 and stage 1, 95% cure rate.
Maria Bermudez was reluctant to get a mammogram after she noticed some bumps. At the age of 33, she became the first woman in her family to be diagnosed with breast cancer, but she caught it early. Now she, along with fellow survivor Marissa, as well as doctors, are asking women to take charge of their health.
Speak up for yourself and don't be afraid to. I know it's difficult.
You are your number one advocate as a patient, you and your family. And if you feel like something is different or something is wrong, then you have to listen to yourself and seek out a doctor or seek out your doctor and talk about that.
Maribel Gonzalez, CBS 2 News.